Ikke sant? Jeg må ta plass, mister. Ja, velkommen alle sammen til vårens første åpne møte i SIOPS nye info- og ressurssenter. Det er jo veldig hyggelig å se at folk har kommet såpass mange til tross for det dårlige været. Vi skulle jo egentlig hatt litt servering av pølser før møtet, men vår pølseleverandør han er fast i trafikken. Han er på vei, så da blir det pølser i pausen i stedet for. Så jeg håper ikke dere er litt sånn helt dødsultne, men at dere klarer å vente en halvtime, 3 kvarter. I dag så er vi så heldige at vi har fått besøk av Bobbie Ray-Sannerud, som er klinisk psykolog. Hun jobber til daglig i det norske Veritas. Hun har 8 års erfaring fra det amerikanske forsvaret og har jobbet med veteraner. Har en doktorgrad fra Center of Veteran Studies i universitetet i Utah og skal snakke blant annet om søvnforstyrrelser, søvnhygiene og angstmestring, og så kommer du sikkert inn på litt andre temaer også. Så jeg gir bare ordet til deg.
Ok, ja. Takk. Og beklager at jeg skal holde foredraget på engelsk. Kanskje om 10 år kommer jeg tilbake. Jeg lærer meg norsk, og jeg kan gjøre det på norsk. Så jeg skal skifte. So, as he mentioned, I have a background in clinical psychology. I'm a licensed psychologist in the US, as well as here in Norway, actually. I've had the experience in the United States military, both clinically and through research. And I've published several articles on topics related to military psychology. But today I've been asked to offer some practical information that you can utilize for topics related to military mental health, as it could apply to veterans or active military personnel. So please, if I'm using, I know that all of you speak perfect English because I'm in Norway, but if at one point I'm saying something that isn't very clear, please just stop and we can do a quick translation, okay? Or maybe I could attempt to do it in Norwegian. Just an overview, I'm going to talk about 3 very general topics, but very important topics, because these are topics that hopefully I can offer some advice today that you all can walk away with and utilize some tips from this on stress management, coping with anxiety, and sleep hygiene, okay? So this actually can relate to anyone, even if you don't have military experience. But specifically for the military population, there are some factors that contribute to stress, anxiety, and sleep issues within this group. I can make a very long list, but in short, this is a list that I've kind of just made related to how there are risk factors that can contribute to these areas. For example, deployment, whether it's peacekeeping missions or in combat zone, there are factors related to these type of missions that can contribute to stress and anxiety, and as we know, PTSD. Just even the transition of coming home, whether it was yesterday a veteran came home or 20 years ago, there's still sometimes some residual effects of that transition of being in a combat zone and living that type of lifestyle in combat, and then coming home and being with your family and going back to the daily routines. On top of that, the military environment tends to be a more high-paced, high-stress type of work environment. There tends to be more erratic work schedules, different sleep routines. These types of things can contribute to certain stressors depending on the environment the person works on. So, not to mention the transition from military to civilian life. A lot of work that I've done actually is working with veterans who have transitioned, very excited to retire from the military, kind of move on. So they have these plans that they're just going to watch TV all day long and they're going to live this great life. But they noticed that the transition was not as smooth as they had hoped it to be. And then that kind of, a lot of them complained that there's a sense of boredom, as not feeling this sense of accomplishment anymore, kind of being out of routine, caused a lot of stress. And for some people, they had to face some things that they were able to kind of distract themselves from over the years. So been different issues related to that. I would say the most common issue would be sleep issues. So hopefully you will find some of these topics interesting for you. And again, please ask questions if you have any.
I have one. What do you mean by moral injury?
Moral injury, we've been going back and forth whether or not I was going to talk about it, and the vote is yes, that I will talk about moral injury today. So I have that at the conclusion. I was going to ask you all if you're interested in a discussion on moral injury, so I will get back to that. So it sounds like we have one vote for moral injury. Okay, but I will start with the management of stress. To start with stress, the most important key thing with stress is to understand stress and understand what it is. There is this kind of stigma associated with the term stress, and especially when you talk to military personnel, this kind of tends to be this more masculine population. And when they hear this term stress, so it's not me, I'm fine, I'm resilient, I'm strong. But stress is actually a very natural response that if you understand, accept it, you can embrace it and utilize it, because stress is something that we actually need in our lives. If I didn't have stress, I would have never got my doctorate. I would have probably never done anything to create such a presentation, right? We need stress to work in our favor. So there's different ways of looking at stress, and I'll go into detail about that. But what we know about stress is it's the result of the interaction of physiological and psychological effects. So it's the way that we digest our world and interpret and understand it, and it's how our body responds to it. So depending on your backgrounds and where you come from and how you were raised and what you've seen and done in your military careers, you will interpret your environment differently from the person sitting next to you. Okay? So let me go into detail about that. What we know about stress is if it kind of goes up like a staircase is the way I like to describe it. If you think about someone who has no stress, they're at a very kind of meditation state. They're either sleeping, they're bored, but they're not in that type of aroused state. You don't want to be here if you're in combat, right? So just another example of how stress actually serves a purpose. There's an optimal level of stress that we have that actually heightens our acuity. We have better situational awareness. We're aware of our surroundings. We are better able to respond and react. So there's different techniques that can keep us in this zone. But we know if stress is occurring and it's chronic, that it can move up to excess stress. And that's when we kind of lose that situational awareness and lose control. Our reaction time isn't as great. So this is when it becomes more harmful. The good news is there are ways to bring you back down to this level if you're aware of it happening, right? So if we're not in denial that this is going on, or if we're aware, there's simple techniques that we can use that I'm going to talk about that you can utilize on a daily basis that can bring you back down a staircase. So if something does happen that is very stressful, you have resources to cope and deal with it. If you're already up here and something very stressful occurs in your life, what resources do you have to deal with it? Okay?
So I've got another question. So
Yes, sir? Yeah?
What do you mean by SA?
Situational awareness. Okay, so let's talk about the physiological response to stress and how to cope with that. When I say physiological, what I mean is our body's natural response to stress. when we are stressed, this is natural response that our body goes through. Has anyone heard of the fight, flight, or freeze response? Okay, so for example, if a big bear were to walk into this room right now, naturally, hopefully, we would all go into this survival fight or flight freeze response, right? Our heart rate would go up, our breathing rate would increase, pupils would dilate, our muscles we would tense them, okay? A digestive tract actually stops. There's a lot of stuff that goes on with our body when we're stressed, and that's because we need to do that in order to flee or fight to survive in this situation. The funny thing is, though, we can get into that mode without a big bear being in the room. So we can, just thinking about something can elicit that same response. So just thinking about something that has happened to you and reminding yourself of that can elicit that physiological response. Thinking about something that's going to happen, we call it anticipatory anxiety, can elicit that response. Okay? So then it's time to be aware of what's going on with your body, because our body sends our mind a message and then we respond to that. Has anyone heard of relaxation techniques or strategies? Has anyone used any of these? Diaphragmatic breathing, progressive muscle relaxation. They may have different words for it in Norwegian. I'm going to go through these, but these are very basic breathing exercises that we teach to military personnel. And the cool thing about these breathing exercises is I'm not asking you to sit in the corner, cross your legs, and say, It's actually a technique that you can use, and no one will know that you're doing it.
So another question.
Yeah.
What do you mean by autogenic?
I'm gonna go through each and every one of these. No, it's okay. I'm liking your questions. Keep them coming. Okay, so diaphragmatic breathing. This is, of all the techniques I'm going to talk about, if you leave here today with anything, this breathing exercise is key. It's a very easy technique. In fact, when I tell you this, you may think, I already do this, but you'd be surprised if you practice that you may not be already doing it. Diaphragmatic breathing is a process of lowering that physiological response to stress through breathing slowly and through your diaphragm. Again, with the bear example, if the bear walked into the room right now, or if I just went on a run and came in this room, right, I would be breathing with my chest, right? Not with my stomach. Can everyone please put your hand on your chest and on your stomach? And now just take a deep breath and see what that looks like. Okay. Now, how many of you would say that your chest moved up and down? Okay, I saw a lot of chest. Okay, now I want to try something. Try to breathe with just your stomach, not your chest. It's not so easy, so I'll teach you how to do it and I'll tell you why. Picture a balloon in your stomach and you want to fill up that balloon and then you want to blow out the balloon. The easiest way to do this is if you're laying down, because naturally it's easier to breathe with your stomach when you're laying down. What that is when you're breathing with your lungs and you're breathing with your chest, you're only filling up oxygen about half. But what we want to do is we want to utilize all of our resources. We want to fill up, take in as much oxygen as possible, because the oxygen will give us resources to relax. In order to do that, we have to slow down our breathing and we have to take a deep breath. But we want to do that through our diaphragm. So just keep in mind, you want to take note. Start to do this diaphragmatic breathing. Some people call it belly breathing. If you think if any of you have worked in combat with artillery or whatnot, when you practice with the pistol, the first thing they say is to take a deep breath with your stomach. If you've been in the choir, one thing they do is they say take a deep breath breathe with your stomach. So this is a technique that is actually used in different occupational settings. In combination with that is a body scan. A body scan is also another technique that you can do without anyone knowing that you're doing it. I like to say that this is something you should do periodically throughout the day. Again, some people, if they have chronic stress, chronic pain, chronic anxiety, their body is naturally responding to that with tense muscles, okay? So it becomes almost like a lifestyle for you. You almost maybe don't even realize you're doing it. So we have to start to pay attention to what our body is doing, because if we can relax our muscles, it also can relax our mind. In order to do that, you want to do kind of a head-to-toe scan. So I've listed some areas you might want to check out, but obviously you know your bodies better than I do, so you can start to identify what areas are tense for you. But first area that I like to focus on is paying attention to your forehead. I worked in the chronic pain clinic, and I worked with a lot of people who had migraines, and it's funny how much they move their eyebrows and they tense their eyebrows and didn't realize that they were doing it. So it's fun to take notice and see what's going on with your eyebrows and relax them, relax your forehead. And then scrolling down to your jaw. Do I have anyone that grinds their teeth here? It's a very common condition, grinding teeth at night, grinding teeth when you don't realize it. Or your dentist will let you know because your teeth will be half its size. But teeth grinding is a very common symptom of anxiety, and a lot of it unfortunately happens when you're not realizing it's happening. So this is why the body scan is really nice to do, because you can draw attention to your jaw and see what it's doing. Naturally, our jaw is actually supposed to be a little bit open. Try to picture a small pencil in between your teeth. That's how much open it should be. The only reason why we should be closing our jaw is for eating. Other than that, it should be just slightly open. So if you're noticing that you're closing your jaw often and clenching your jaw, that is something that you may want to focus on. And there's a lot of different solutions for that. Right now, a quick solution is really just the awareness that you're doing it and monitoring that and releasing your jaw and relaxing it. Moving down to your shoulders. Stress individuals, you'll notice, have shoulders that are kind of up like this. If you work at a desk, look at your chair. How is it seated? Is it pushing your shoulders up? Looking at your shoulders and relaxing them, those muscles can really contribute to a lot of stressors if you're not paying attention to what they're doing. Moving down to your chest. Are you breathing from your chest or are you breathing from your stomach? And you can reverse that with the technique I just taught you, diaphragmatic breathing. And then your hands. A lot of people, when they're stressed or angry or anxious, they tend to pick at their hands or they clench their hands. They do a lot of different cracking with their hands. So it's good to kind of just open your hands and relax and reverse that. And finally, the legs. If you're sitting, the recommendation is that you should uncross your legs, relax your legs, keep a small space, whatever is relaxing for you, of course, but monitoring, just making sure that your legs aren't tense and your toes aren't crunched. So does that make sense that maybe a body scan going from head to toe would be beneficial, and monitoring just how your body is responding throughout the day? What I like to recommend is finding ways to remind you to do this. So there's cues in your environment. For example, what are some things that you do every day that could remind you to do this? For example, I'm in Norway. Norwegians drink like 4 to 5 cups of coffee a day, right? So throughout the day. So a cup of coffee. I'm going to do a body scan before I have my coffee. In the US, we would say every time you get in your car, because we're always in our car. So every time my patients got in their car, they would do a body scan. But there's something in each and every one of your environments that you can say, this will remind me to do it. I had a patient once that said, every time I check my email, if I did that, I'd be just doing body scans all day long. Okay, Autogenic relaxation. There's a lot of different relaxation techniques I could have chosen today to tell you about. The reason why I chose autogenic relaxation is because not a lot of people know about it, but it's really a very fantastic relaxation technique. We did this a lot in our chronic pain clinic. It's really fascinating what your mind can do. And I don't know if you have heard the saying, the mind leads the body, but it's really interesting that the things we tell ourselves, how our body can react to that. And there's been a lot of studies and research on this technique, and I'm just giving you a little short 1-minute description of that, so I recommend you looking it up and reading more about it. But essentially, it is similar to a body scan in that you're going through your body, but every time you go through different parts of your body, you're telling yourself a message. There's actually a script that goes along with this. But as an example, one of them is you're telling yourself, my legs are warm, my breathing is calm, my breathing is regular. We've done a lot with my hands are warm, my hands are heavy. And we're moving down, my stomach is warm, my stomach is heavy. And telling yourself this, going through each and every body part. I used to work a lot with biofeedback, and we would have this kind of thermal, and we would be able to tell if one's body temperature could go up or down. It was really amazing to see that if you send messages to yourself that you are warmer, you can actually increase your body temperature a little bit. And that's really important because we know the warmer we are, that indicates that we're a little bit less stressed. So maybe we can use that outside when we all walk home today. Any questions about that so far? Guided imagery. Guided imagery is a very popular technique, and you may be doing it, not even realizing you're doing what we call guided imagery. Guided imagery is a technique that we also use in treatment for relaxation. There's different ways of doing it. My favorite way of doing it is asking the patient, what is a relaxing environment for you? A lot of people will say the beach. If I asked you all, what would you say is a relaxing environment for you?
The glacier.
Yeah, the glacier, yeah. The mountains. Yeah. So if you think about the mountains, what do you see when you see the mountains?
I see a lake, and it is not very windy, it's still,
Mm-hmm.
and it's sunny. That's my image.
Great. So you're seeing water. Water is a very common image that people like to see. And what you said is you feel the wind. So you're accessing the sense of touch, understanding what it feels like to feel the wind. So if you close your eyes and you picture this mountain, and you picture the water, and you feel the temperature, and you feel the breeze, but yet you describe the sun, feeling the sun on your face, right? Also, what kind of smells do you smell in the mountains? Is it pine, or is it fresh air? There's specific smells. And if you really sit and you think about all of these things, these 5 senses that we have, and you can really start to access that and take yourself there. So this is a very good technique to use throughout the day or at night when you're having trouble sleeping, if you want to relax before you're going to do something stressful. When I've done a lot of work with trauma, and I had a patient once who we did some trauma. He was a pararescue jumper and had a very scary incident that we were working through that involved having a tough time rescuing someone who eventually died. And at the end of our treatment, we always did a guided imagery exercise. He actually chose the mountains as well. On our last imagery exercise, I love telling this story. he opened his eyes and he was like, wow, I can't believe this. He pictured that he was sitting on this lake, and then he felt someone touch his shoulder, and he turned around, and it was this guy in his image that we had been working through, because he felt guilty for his death. He was not responsible for his death, but that's what trauma does to you. And I asked him, well, what do you think that means, seeing this guy in your image? And he said, I think he's saying it's okay. It's okay. My point is that, yes, this is a great technique for relaxation, but it's really interesting what our mind can do when we kind of go with some peaceful exercises, relaxation exercises. It can be very healing. Okay, so I've talked about what you can do with your body to decrease stress. Now I'm going to move on what you can do with your mind. Okay, and the interaction of the two obviously is the best because they feed off of each other. There's 3 things I'm going to talk about, although I could do a whole 8-hour lecture on psychological interventions for stress, but these are the 3 that I chose to talk to you all today. One is first being able to identify negative, catastrophic thinking. Other one is a technique that we call thought records, and then exposure. So I'll go through those in detail. So the interesting thing about our mind is the messages we tell ourselves. And like I started from the beginning, we all come from different backgrounds. We all come from different life experiences. Especially with military personnel, you can have a room full of military personnel and everyone has had a very different experience, and maybe even those who went on the same mission, did the same service, they have interpreted differently because of their background. They interpret things differently and they tell themselves different messages. So it's interesting to start to pay attention to the messages you tell yourself. So if there's a situation where you feel stressed, embarrassed, fearful, anxious, angry, what is it that you're telling yourself? I gave the example, I am stupid. Because that is an example of when someone does something, they felt bad about it, and they tell themselves, oh, again, I'm so stupid. Right there is where you can start identifying these types of messages that you tell yourself and start challenging it. There's a lot of things that we do when we're not in a good state, when we're stressed. We tend to catastrophize. Catastrophize means that you blow things out of proportion. Okay, so it may be a small event, but because you're feeling anxious about it, you go from 0 to 60. Okay, a little bit of an extreme response. There's other things where it can be very negative to yourself, very negative against someone else. There's various things that we do, but the most important thing is being aware of what you're doing and being able to identify it so you can challenge it. There's one thing I want to touch on. If I see some of you taking notes, there's a really good workbook called Acceptance Commitment Therapy. And they have different workbooks that you can just take home and go through identifying your thoughts and messages you tell yourself. And the whole idea with this, and it's worked really well with military personnel, is accepting that it's okay to feel stressed, it's okay to feel anxious, and it's okay to go through these emotions, because if you resist them, you're just making it bigger. The analogy we give is quicksand. You know, I don't know if you know, but if you've ever been caught in quicksand, what you should do is just relax and kind of step out of it and get out of it. But if you resist it, you're actually going to sink. It's the same thing with these kind of psychological symptoms. If you're having a moment of anxiety, and what we call is like, this is a clean emotion. What you can do to make it dirty is start telling yourself you're bad or you're wrong or you're stupid for feeling anxious. Just experience the anxiety, be with the emotion, let it ride like a wave, and let it go through its course, because it's not wrong to feel anxious. We're supposed to feel these emotions. Unfortunately, because of society, it's been stigmatized. It's okay to go to the doctor if you've broke your finger and hurt your thumb, or you have some physical injury. But for some reason, over time, it's been not okay to talk about when we're anxious, or we're sad, or we're angry. But these things are very natural, and they're supposed to happen. I'm more concerned when my patients tell me I don't feel anything. That's more concerning to me. I can't even work with that. Outside of acceptance commitment therapy is the use of a thought record. You can Google this on Google Images. You can print out several different ways of doing this. But it's basically a worksheet where you can start to train yourself to identify different thoughts that you're telling yourself, different messages you're telling yourself. And basically what it does is it takes you through these thoughts and you identify them. How much is it impacting you? On a scale from 0 to 100, let's say 0, no impact, 100, I'm very anxious, I'm very stressed about it. Okay, where do you think this is coming from? Thoughts, beliefs. And then I like to think of it like in court. Okay, so you're saying that you feel stupid because you weren't able to pass this driver's test. Let's present this to a court. What are some facts to support this idea? Well, I should be able to pass my driver's test. I'm 30 years old, and that must mean I'm stupid. Okay, there's your fact. What's your facts against it? Okay, it was snowing that day. You can take the test again. There's lots of people that take driver's tests and fail. So you kind of have the two courts arguing over facts that support it and facts that do not support that thought. At the end, you come to a more balanced perspective. Okay, I'm very upset that I did not pass my driver's test, but I'm going to try again next time. You acknowledge you're upset, but you're not telling yourself you're stupid. And then identify where you stand on this scale. Maybe you started at 90 of being pissed off and upset, but now you're at 20. I do this a lot with trauma as well. I will have for military personnel that are coming home and they are having a difficult time around certain situations, let's say a crowded restaurant. And I will have them utilize this. Okay, go to the restaurant, identify what thoughts you're telling yourself, and challenge those thoughts. Is it realistic that you should feel in danger in a crowded restaurant? Okay, we have some evidence that maybe it is a realistic thought, but we also have evidence that it's not a realistic thought. So just taking the time to kind of examine both areas. Because if you're just looking at facts that support the thought, you're not doing anything about it, and your body is responding to that. Another thing you could Google is thought record, also ABC worksheet. That one is kind of a little bit of a simpler format to guide you through that, and it just talks about the activating event, your behavior, and the consequence, and asks you to kind of re-examine that. Okay. Exposure. Exposure is not only useful for stress, anxiety, but also trauma. A lot of these topics that I'm talking about, I know I've categorized it under stress or anxiety, but really they're useful for most psychological difficulties. Exposure. If there's an event that stresses you out and it's not does not harm you or yourself or your family, and realistically you can go into that situation, the key is not to avoid it. It makes sense that if we're feeling stressed, I went to work, I felt like my colleagues were picking on me and I no longer want to go there, I'm going to quit. If you use that type of system, what you do is you're telling your mind that it's okay, it was dangerous, and you're reinforcing that idea that this environment was dangerous. But in reality, it was not dangerous. So we have to start to re-examine situations and confront them. even if it does cause a little bit of stress. Now we have techniques to use if we're in a stressful situation, because we know if we re-expose ourselves to a stressful situation or something we're afraid of, naturally over time your anxiety decreases. It's actually one technique we use for trauma, is we will have someone go to an area that makes them feel very anxious, and we'll have them sit with that anxiety, sometimes up to 45 minutes, and inevitably after 45 minutes, even if their anxiety started at a 90, they can decrease it. It will lower, it does not get higher over time. So we know that over time our anxiety will decrease. If you're afraid of spiders, what's the treatment for that? Well, I'm going to throw a bunch of spiders at you until you're not afraid of them anymore. Obviously a lot nicer than that, but you get my point. Exposure. Expose yourself, not avoid. Okay? Coping with anxiety. A lot of what I just talked about you can use for anxiety as well, and hopefully I've conveyed that. But just to make it a little bit more specific, I have this continuum here of anxiety. Again, anxiety is a very natural response. It's a natural response so we can survive, so we can cope. We want military and veterans to feel anxiety if they're in a situation that they need to. We want you to have that response time, especially in combat. Extreme anxiety, however, if there's no threat, and you're feeling this anxiety response, that's when we kind of say it's a little bit in the red zone, and you should start examining what thoughts you're having and what your body is doing. If that continues over time, there is this kind of prolonged anxiety, and it starts to interfere with your life. If you're not going to work because of your anxiety, if you're avoiding people, relationships, and if you're using different means to cope with it, like alcohol, drugs, other sources that kind of calm you that are not healthy, this is when you're in this zone, and it's good to take a step back and kind of look at how to address that.
Can I just say that?
Yeah?
I think you've forgotten one thing. Between the first and the second,
Mm-hmm.
I label it fear of the unknown.
Mm-hmm. Yeah. That is the
Which
definition.
is a horrible situation to be in.
Mm-hmm. Yeah, it is.
Before battle.
Yeah, they say the definition of a really good definition of anxiety is that kind of not knowing being unable to deal with unexpected, not being able to deal with the expected. So uncertainty, that's the word I was trying to find. So not being able to deal with uncertainty. And that is anxiety provoking. We like to plan, we like to know what to expect. So yes, definitely. I went into a lot of detail about different coping techniques, but what I wanted to say specific to anxiety is there's this vicious cycle that happens with anxiety. And if you were to go to a therapist about this, what our job is to break the cycle. And there's various ways that we do that, and different therapists have different techniques. And there's some ways that you can do on your own. But knowing that anxiety has this kind of cyclical effect that feeds on your thoughts, behavior, physical sensations, and emotions, you can start to address these one at a time. I've talked about how you can do that. Again, anxiety thinking, challenging anxious thoughts, addressing them, using different strategies to tackle them. Also your behavior, not avoiding situations that make you anxious, making sure that you confront them. There's relaxation strategies that I've talked about to decrease that physiological response to anxiety. And then emotions, again, accepting that these emotions are natural. We don't want to pathologize ourselves because we're having a natural response. It's just about how we deal with our emotions.
Excuse me. My experience is that many have a strong union between thoughts and emotions.
Mm-hmm.
They're not able to separate them enough.
Yeah.
So many who I talk to, they are each.
Yeah. Yes. I'm glad you brought that up. Thoughts and emotions, we actually have, there's this new generation of psychology where we're trying to, we call it emotional coaching, where we're trying to teach our children to identify their emotions so they can understand how they're feeling and to separate that from a thought and whatnot. But it's funny because we're doing a lot of that work with adults, is identify the emotion. Why do you think you're having that emotion? But it is interesting, a lot of adults are very confused. I don't know if it's anger or if it's sadness. So it's good to start to kind of reflect on the emotion that you're experiencing and understand what thoughts are feeding into that emotion and influencing it. Kind of like the diaphragmatic breathing that I talked about. I'm sure when I started that talk, you're like, yeah, I can totally breathe from my stomach. And then you're like, oh, this isn't as easy. Same thing with our emotions. It sounds pretty easy to say, yeah, I can tell when I'm angry and I'm sad. But really, if we really start to examine when we're having an emotional episode or stress, to identify what type of emotion is going on. Can I switch? I just threw this slide in last minute because I like to bring it up, especially when I talk about anxiety. Obviously, post-traumatic stress disorder, it's not on the agenda today, but just very quickly, post-traumatic stress disorder is the result of a traumatic event. If you're feeling anxious and it's around a certain theme, it's possible that it's due to, it may not be PTSD, a disorder, but maybe kind of the difficult coping or adjustment to a particular event. The way I describe PTSD is when we have anxiety, let's say you're in a combat situation that triggers, that was very scary, and naturally you have a response that triggers increased heart rate, distressed thinking, couple bad nights sleep, that sort of thing. You're kind of going through the natural emotions of anxiety, of coping with a difficult situation. But naturally, over time, we return back to our baseline. This is where I see my patients. I like to describe PTSD as a condition of being stuck. For some reason, they just got stuck right here. And they're living their lives, doing their daily routines in this heightened arousal, all in response to some sort of traumatic event. So our job as therapists is to help bring these individuals back down to this baseline through different types of techniques. Okay. Sleep hygiene. Sleep hygiene is a really popular topic in the military. It's the most reported issue to primary care physicians. Over 70% of patients will say either primary or secondary issues are related to sleep. We've all had a bad night's sleep. Any chronic bad night sleepers in here? Yeah. It's very, very common. So just know if you have some sleep issues, you're not crazy, you're not the only one. You're actually more common to have these sleep issues than the other side of the population, which is why it's such a huge market, with sleeping pills and all these different types of strategies and products to help people with sleep. But what we do know is short-term sleep medication is effective, but it's not designed for long-term. The most effective techniques you can use for the long term isn't something you can buy. It's something that you do. It's behavioral techniques. Okay, so it's how you train your body to sleep. So I'm going to go over some of these. Really quickly, sleep complaints can vary. There's different ways that people have sleep problems. There's people who, no matter how long they sleep, they wake up feeling completely exhausted. There's individuals that have trouble falling asleep, Or there's people that they fall asleep fine, but they wake up too early, or they wake up in the middle of the night and cannot return to sleep, or a combination of everything. Sleep problems can result from all kinds of different things. It can result from a traumatic event. It can result from just poor sleep hygiene catching up to you over time, shift work, stress, jet lag. I mean, we can create a long list. The good news is these techniques help no matter where your sleep problems are coming from. A lot of these techniques can help with that. But it's good to explore the root cause. Obviously, if there's a very strong root to that, it's good to explore that and use sleep hygiene techniques in combination. Okay, so behavioral techniques that are described as like the state-of-the-art package consist of these, and I'm going to go through each and every one of these. Sleep restriction, stimulus control, sleep hygiene, education, cognitive restructuring, and of course, relaxation techniques. So has anyone heard of this by any chance? Sleep restriction and stimulus control is kind of a big word, but it's actually a very simple concept. Great. Basically what sleep restriction is keeping your time in bed to just that. So what most people, when they're having trouble sleeping, they're laying in bed awake for hours at a time, right? So one funny thing that, my best example for this, especially working with retirees, is they come in, I have these horrible, I can't sleep. I just can sleep on my couch, okay? So they only can fall asleep on their couch. That's because they've built this association with the couch as a place for sleeping, but the bed is a place of stress. Because if you think about it, if you're laying in bed for hours at a time, obviously frustrated because you can't fall asleep, anxiety is going on, you're starting to identify this bed as a place of stress. I mean, it becomes like a thing when you're going to bed, looking at your bed like, what's it going to be tonight? Knowing there's a struggle. It's this kind of like anticipatory anxiety about going to bed. This is why you have to limit your activities in bed. Take away all awake activities. If you don't have sleep problems, it's okay. You can do whatever you want in your bed. But what we would tell people is you limit your activities to just sleep and sex, okay? So no watching TV in bed, no talking on the phone in bed, no doing homework in bed, those sorts of things. Just sleeping, okay? Because you want to build an association with the bed. It is very true that we have associations in psychology. This is a big talk with Pavlov's dog, and I don't know if you've heard that, where scientists taught his dog, I'm going to ring a bell, and you get a slice of meat, and over time he rang the bell, and there was no meat, but the dog would salivate because there was an association with the bell. We do these things. When we smell certain smells, we have an association, we respond to that. When we see things or see people, talk to people, we have associations. That's what we do. That's what our mind does. The same thing with the bed. So hopefully I've made my case that the bed is a place for sleeping. And if you're not sleeping in your bed, you have to get out of your bed. So how do you do that? Well, most of you will know if you've been in bed for longer than 20 minutes, right? You cannot clock watch though, because we know that clock watching does what? Triggers anxiety, because you do the countdown effect. Okay, now I have 7 hours left. Now I have 6 hours left. Now I have 5 hours left. So we used, back in the day when we actually used clocks and not cell phones, we would say put black tape over your clocks. So whatever you need to do to avoid clock watching, but you should know when it's been about 20 minutes. And so remove yourself from the bed. Go to a relaxing environment like the couch or whatnot. Don't do anything too stimulating. Read a book, play Sudoku, whatever it is. You may not want to watch House of Cards or anything super stressful like that. But what you want to do is you want to distinguish between feeling tired and feeling sleepy. Does anyone know the difference between feeling tired and feeling sleepy? Have you ever thought about that? Tired is probably how we feel right now. It's the end of the day, ready to go home. Sleepy is when your eyelids cannot stay up. They're going to shut. You're very sleepy. That feeling means that you should transition to your bed. When you first start this, unfortunately, you may have that sleepy feeling, go into your bed, and that, unfortunately, you have such a strong association with the bed, it may trigger you to wake up. But you just have to repeat the cycle and over again. The key is to stick with this routine, okay? So even going to bed, a lot of people say, well, I have to get up at 5 in the morning, so I prefer to go to bed at 9. Okay, but if you're not sleepy until 2 in the morning, you have to go to bed at 2 in the morning and then still wake up at 5. But over time, you'll see, now you're going to bed at 1. Now you're going to bed at midnight. Now you're going to bed at 11. So hopefully you guys kind of get where I'm going with this, okay? It's very hard psychologically and stressful to go through this type of treatment regimen, which is why it's much easier, I know, to go pharmaceutically. But we know long term that the sleeping pills do not work. We're going to build a tolerance to it. What we do know, if we can teach our bodies to associate the bed with the place of sleep, and actually sleep in our bed, that's the best technique. So big words called sleep restriction and stimulus control. I usually talk about this for like 2-3 hours, and I just did it in 5 minutes. So does anyone have any questions about this concept before I move on? No? Okay. So there's some things that you can do to better improve your association with the bed. The first one is promoting a relaxing sleep environment. I've had patients that went and like painted their room a different color, bought new bed sheets, those sorts of things. Whatever suits you best. You don't have to go so extreme. But what I would recommend is that you do look at your sleeping environment and see, is this a relaxing environment? For students, I've worked with a lot of students that they have their kind of desk with their calendar and their to-do list of exams, and then there's their beds. The last thing they look at before they go to bed is their to-do list. That's not a very conducive environment for sleeping. So just having a look around and seeing, is this an environment that is relaxing? Are the colors relaxing? Are the smells? Is it clean? Is it tidy? So starting with little things like that. Also, there's stuff we do with our routine, our bedtime routine, that help with sleep. What are you doing before bed? Are you doing a stimulating activity that takes you time to wind down? So maybe you can start a wind down routine an hour before bedtime. We know that raising your body temperature and then decreasing it promotes relaxation. That's why people say it's good to work out, raise your body temperature and then decrease it. Or you can take a warm bath or a warm shower. Those sorts of things. Have a cup of tea, no caffeine. There's certain things you can do, but if you plan ahead, this is my sleep routine, this is what I'm gonna do to promote relaxation and turn off that fight or flight response. Substance use, when I studied abroad in Germany, and when I lived there, they had a saying that beer is good for sleep. And a lot of people believe that, but unfortunately what we do know is that beer and alcohol metabolizes while we sleep, and if we do this on a routine basis, you will wake up craving for more. Same thing with tobacco. If you're addicted to these kind of substances, it metabolizes, and it's kind of like an unconscious thing that happens that you wake up craving more of that substance. Caffeine, same thing. If you have sleep issues, the recommendation is try not to have caffeine after lunch. Try to limit your intake because caffeine is a stimulant. You don't want a stimulant in your system before you're going to bed. And also pay attention, there's a lot of beverages that have caffeine in it that you may not even know. Physical exercise, this has been like, there's a lot of literature on physical exercise and sleep. What we do know is it doesn't matter if you work out in the morning, the afternoon, the middle of the day. What we do know is physical exercise, period, will help with their sleep. So it's good to add physical exercise in your routine. Something that raises your heart rate and decreases it, okay? And strategic napping. Napping is a very good coping skill that a lot of my patients use with sleep problems. They're very good nappers. But we do know that if you are going through a full sleep cycle during the day, it kind of eliminates your chances of doing it again at night. So the best advice is to cut out naps altogether. If you must nap, there's a strategic way of doing it. Try to keep your naps under 30 minutes. They say like a 20-minute nap is equivalent to drinking a cup of coffee. So making sure that your nap isn't a couple hours long and you've gone through all your sleep cycles, and of course it makes sense that you're not going to be tired at night. So making sure that you're napping, if it's a must, that you're doing it strategically, and knowing that you are napping. I've worked with a lot of people. We had these actigraphy watches, so we would have them take them home. Oh yeah, I don't nap, I never nap. And then they come back and we have this report, you're napping during the day and you don't even realize it. I mean, there's some people who watch TV, fall asleep, actually fall through a sleep cycle, not even realize it. So becoming aware of that as well. So that is, in a nutshell, some sleep hygiene techniques that I went through very quickly. Do you have any questions? Any of these feel like you would be useful for you? The advice is if you can just take one of these recommendations and give it a month and just try it and be very committed to that. But the best recommendation, if you do choose anything, is this. This is the most effective technique, is the sleep restriction. Last but not least, very quickly, big word, cognitive restructuring. What kind of thoughts are you having when you're laying in bed? Anxiety is a very common response to sleep issues, laying in bed and telling yourself messages like, tomorrow I'm not going to survive, now I only have 2 hours sleep, I'm not going to be able to function. When you tell yourself these messages, naturally, what does that do? It elicits an anxiety response. You're scaring yourself. So finding a way to distract yourself from these thoughts is key. And I say distraction because it's really hard if you've been doing this for years to change it immediately. But over time, during the day, it would be good to practice these techniques I talked about earlier, identifying negative thoughts that you're telling yourself, challenging them. So when you're laying in bed at night, you can better do that. When you're having these types of thoughts and it's still in your 20-minute window, or you've removed yourself and you're on the couch, try the diaphragmatic breathing, because that elicits relaxation and kind of turns off that physiological arousal. Here is a relaxation exercise that has been very popular with military, is called square breathing. Basically what it does is, I like it because you have to focus on a square and these numbers, and it's a lot to think about, so you can't pay attention to the negative thoughts you're telling yourself. I recommend at first drawing this and maybe putting it in your wallet or your pocket. Practice it during the day, but what you see is there's numbers on the side, 1 through 4. So what you want to do is, in combination with that diaphragmatic breathing, you want to count, you want to go in for 4, so it's very rhythmic. Breathe in, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. Do you see how it's going? When you're breathing in, you want to breathe in from your nose and out through your mouth. So can you imagine? So there's a lot to focus on. So this is a very good technique to do when you're laying in bed. Should we move on to moral injury? Do we have time, or is anyone interested? If not everyone's interested, I could talk to people on the side, or...
Could we have a small break?
Yeah.
Sausage break?
Oh, yeah. Gotta have pulse.
Pulser og twist. Oi, den kommer, så bare bli sittende. Beklager.
Perfect, you'll stå her. Okay. Litt her da. Okay. Var det halv ansikt sånn? Okay. All right, so I'm going to just spend, depending on how much we talk about this idea, this concept, moral injury, I'm going to talk 5 to 15 minutes on this. And then I'd love to have some discussions, questions, anything you want to talk about, anything I've talked about today. So like we talked about, we were debating whether or not moral injury should be a topic for today, but it sounds like you're interested. So I did not come prepared with a big, long presentation on moral injury, but I do have 3 slides that I think can give you all an idea to walk away with and understand what this concept is and what it means. And already we have someone applying it to different situations. But moral injury is it's an emerging concept that's coming out. It's not necessarily a diagnosis per se. Who knows what will happen in the next coming years? But we know that this is something that is a response that is happening. And I wish, as a clinician, that I knew about this concept of moral injury 5-6 years ago when I was working with military personnel, because I often had cases where it wasn't necessarily that they were having this kind of tick box PTSD reaction, but yet there was a reaction. And now that I've explored moral injury, both through research and applying it to patients that I've had, reading about it, and if you are curious on it, the VA in Boston is doing a lot of work on this right now. I see that this is a concept that could have applied to a lot of my patients, and it would have been nice to talk to them about this. If you think about war, then it's a natural prescription of war is violence, is terror, are things that are very against our own culture, values, and morals, right? Western society, the way we've been raised, the way we've been told how we treat one another, how we experience our daily lives. A lot of people have this kind of, if you do good to others, they'll do good to you, kind of metaphor and whatnot. We have these ideas that throughout our life experiences and our culture and our backgrounds that kind of train us to think in a different way. So we're thrown into and I will use combat as an example, a combat zone that goes against all of this. It makes sense that naturally you're going to have a transition, you're going to have a reaction to that. It may not be pathological, but you may have a reaction to that. And one of those reactions can be is shame and guilt associated with what you're seeing, what you've done, what you've heard about within this context of war, okay? And what that is labeled is moral injury. So I'm going to go into more detail about that, but here's your definition on paper. There's lots of different ones, so you could Google. There's probably like 7 different definitions. What do you not agree with?
You use the word shame.
Mm-hmm.
Why should I be shameful of being a regular army soldier who's committed himself to be a soldier, a professional soldier, who's signed on the dotted line, given my rights of whether I should go to war or not away, but nonetheless are quite proud that I've done that, and that maybe one day I will fight for my country as a professional soldier. I do not feel a sense of shame over that and the possibility that I'm going to meet all these nasty things that are going to pop up on the battlefield.
Right. And no one says you should feel these feelings, right? In fact, that's actually what we tell everyone, that this is a very proud career field, very proud professional, it's very patriotic, and that we do these things. But what happens is if you're put into a different environment and you see things and do things that go against your culture or values, you may or may not have a reaction to it, right? But there are some people who have experienced things in war, and obviously my experience is more within OEF. These experiences have gone in Iraq and Afghanistan. I've worked with the last 10 years. I think that these experiences have affected people because it goes against their their values, the way they've been raised. And like I said, this type of shame, it doesn't have to be stigmatized that it's something bad, that it's something that you shouldn't feel, but it is something that some people may have a reaction to, and it can describe it better with this slide here.
Sorry, I'm a dinosaur.
Yeah.
I don't belong to the Iraq era.
Yep.
I don't belong to the Balkans.
Mm-hmm.
I belong to the Falklands War era.
Mm-hmm. Mm-hmm.
And that was, dare I say it, a popular war in Britain at the time, with more than 80% of the population supporting that one should go down south and retake the islands. Quite different from
Yeah, definitely. Definitely. But even if you have your, the civilian population is supporting the war, it doesn't mean that when you go there and you see things, these contexts, that these natural things that happen in war, violence, disasters, these sorts of things that happen in war, you can still have a reaction to it, no matter what.
I agree, you can have a reaction.
Yeah.
But I wouldn't use that word shame. Definitely not.
Maybe you would not, but there's lots of people that feel shame and guilt from what they have done. And because of the way what we're told of how we should serve and be proud of what we've done, they're not feeling very comfortable talking about it. In fact, moral injury is very hard to detect, because being in the military is something you should be proud of. It's very, very prestigious, very rewarding career field. But if you're going to come into a therapy room, one, usually military personnel don't come in until they're broken, because it takes a lot, because of the stigma of mental health, to come into the therapy room. Two, it takes a long time. It's like an art to detect what is actually going on. And shame and guilt, the symptoms aren't so clear. But usually we can detect it over time by hearing the stories of what people are telling me and what they've done and what they've seen, and the contrast from that of what they feel and how they blame themselves. A lot of what I would hear is kind of this self-blame. I did this, I shouldn't have done that, or he shouldn't have done that, that sort of thing. You seeing that there's kind of some symptoms and they're a little bit stuck on that. This graph here, I took some of the literature and I tried to make it into a more easily understandable framework here. But basically what I'm saying here is an individual can either perpetuate, elicit, fail to prevent, witness, or learn about acts. And these acts can contradict their kind of rules about what is right and what is wrong. And then an inner conflict can emerge from that. This emotional distress that can result in feelings of guilt or feelings of shame. Guilt about others, guilt about what you've done. Shame is more about what you feel within. And we're saying that this whole framework results in what we call moral injury. And there's different areas or themes associated with that, not limited to just this, but certain acts that can lead to moral injury is betrayal. I've heard a lot, a big theme that I heard in my practice is feeling this kind of leadership betrayal, leaders making decisions that they felt were not morally sound or ethically correct according to what maybe the team or the platoon felt was right, and a decision was made, somebody died, or many people died, and feeling guilt or shame associated with that, questioning themselves. I started to look more into moral injury when I've had patients come in that have a history of being very religious, and now they're questioning God and questioning their existence and questioning the good in the world, those sorts of things. And I get over time we question our own faith and whatnot, but when there's such a drastic change and you just came back from combat, this is an area to explore. Inappropriate violence. A lot of violence is expected in combat, but there's certain violence that can occur that is perceived as inappropriate or even unexpected. And I have lots of stories about that, themes from patients that have given where they have witnessed, especially when it's revolved around children and mothers, and seeing and witnessing that. For a lot of patients, I think they feel that it's a little bit more acceptable for them to be in combat with other males. But when there's children involved, and they're witnessing children with explosives, or they've witnessed them, or they've come, I've worked with a lot of pararescue jumpers, which are, they come in and they kind of do the ER, they come in, they're medics, and they come in and they try to do these rescue missions, and they've come across small children and babies, and they don't feel like this should not be a part of what they feel war is. Violence among peers, seeing your own peers having violence against them, feeling like you didn't do enough to help them, feeling like you didn't do enough to help your leader to make the decision. There's different themes around that. And then excessive violence and cruelty. There is a famous experiment that was done a long time ago called the Stanford experiment. Have you heard of it? Prison experiment. We use that as an example often in moral injury, because when you remove someone from their natural setting and you put them in war, obviously for survival you have to act and think differently. Okay? And so you have to do these things because it helps you survive both psychologically and physically. But once you come back to home and you transition and you reflect on the things you said and the things you did, a lot of people have a really hard time accepting that. And they have a hard time understanding why they did that. Without going into too many details, I had a patient who did come across a lot of children who had burnt alive and even boiled, and him and his colleagues would make jokes that when they were eating chicken, that, oh, we're eating the babies, ha ha ha. I mean, when he returned, he said, how could I make jokes like this about the children? How could I do that? What kind of person am I? I'm not like that. I have kids of my own. But this is what he had to do in the moment to cope with this excessively inappropriate violence that he was not prepared for. How can you prepare for someone for that? Right? So he had to cope. It was a healthy response that helped him cope and survive. He didn't come back with post-traumatic stress disorder. He was functioning, but he had this kind of these really hard time adjusting to different situations, and came in and we had conversations about this. So this is just one example. Like I said, there's different things that can result in having an injury to your moral self. There's a lot of work being done in this area, a lot of new testing. They're even designing psychological tests to kind of screen for moral injury, because right now in psychology, we're very kind of, do you have anxiety? Do you have combat stress? Or do you have PTSD? But there's kind of something in the middle that we should start looking at, and this is moral injury. I could go into more detail about this, but does this kind of make sense, a little bit more sense now that I talked about it longer? Yes?
Yeah, next question. Speaking of moral injury, I was wondering if you find that moral injury it diminishes or decreases when the enemy is not very moral. If you're fighting an unethical enemy.
Yes. A lot of the common themes that I feel, and this is my personal experience with moral injury, is when someone can identify with the person. So if they feel it's a natural combat environment, I'm protecting myself, you're protecting yourself, one of us has got to go and it's not me, they can deal with that a lot easier. But there's certain cases, for example, I went over the body, I found a wedding ring. Okay, now this person has an identity. Is he married? Did he have kids? Start to kind of over-identify with the person. So that connection results in kind of natural symptoms, you would say, of guilt as a result of killing someone. Talk about drone, works with drones. This is reconnaissance. You're essentially stalking someone. This is a whole different psychological facade going on here. In combat, you're face-to-face with someone, don't really know who they are. At the end of the day, you don't really know what happened to them. With drones, you're essentially stalking someone. You get to know who they are outside of a terrorist. This is a father. This is a husband. This is someone who likes to play soccer. And then if you're responsible for ending their life, this is where I've seen this theme a lot. There is some sort of psychological response to that in the moral domain, because there was an identity. They felt like they felt more connection to the person than kind of a face-to-face combat. So, a big round answer to your question. Yes.
The greatest thing which I've experienced as a former soldier is to have been on Operation Corporate down south in the South Atlantic, fought in the war there, come back, written 2 books about my experiences, and then travelled 5 times to Argentina to meet those guys I was fighting against.
Oh yeah?
And making friends with them. And that, for me, completes the circle.
Yeah,
I
definitely.
have no feelings of shame, regret, or anything about what I did in the Falklands War.
Great.
I met those guys that I always considered were the nameless and the faceless ones on the battlefield, but going to Argentina, meeting them in their environment and communicating with them and making many, many friends has been a great experience.
Sounds like a great, very therapeutic.
That gets you over that hump
Yeah,
that you're describing up on that screen.
Yeah, that's great to hear that. Did you have a question?
I'm a military psychologist. I do the work here that you did in the United States.
Yeah.
I have a bit of a problem with the concept. How does it distinguish really from PTSD? Because many of the things that you describe, I would think could be explained as a PTSD. It's a shocking experience. It's about being threatened, witnessing the threat or death of other people. And so therefore, I've heard of the concept, and I have it's interesting, but it's also, I have a feeling that it's sort of I ask myself, is this a hype? Is this something that somebody's making up or not making up? It's real for the people there, but so is PTSD. So are they making it up to make it something else, something different? So somebody is getting a lot of research out of this, and making a big deal out of this. And is it just or is it? And I would like to hear your thoughts about
that. No, I appreciate your honesty and your comments, and there is some criticism, and with a lot of yes. Oh gosh, how can I repeat all that? Here's the microphone. Yeah. Basically, he's questioning. One, isn't this the same as PTSD? 2, isn't this just another hype and just a way to get some new research, and just wondering what my opinion on that is. And I promise I would have had a better answer if I had more slides, because I have some really cool slides that show the distinguishing features between PTSD and moral injury. I don't have that with me, and so I would have a better answer, but just shooting from the hip, I will give you an answer. There is a lot of literature that compares PTSD and moral injury and kind of distinguishes the two. Moral injury is not a diagnosis, but there's some talk about whether or not it will be in the future. Is it a hype? I don't know. I mean, right now, what I know as a clinician, that I have many patients that have fit within this realm and did not have a traumatic response as within the classical PTSD symptom domains. It says that reactivity, the hyper arousal, and those sorts of things. And that's what they say with moral injury. They're not really having this kind of centered response with this hyper arousal focused on one sort of event that triggers, with PTSD, we know there's certain senses that kind of trigger this arousal. I may be wrong, but right now what I'm reading is it's not in that same area. But but what we do know is moral injury can be something also, it's not as interfering as PTSD, but it's something that possibly maybe in time, does it develop into PTSD? Is it another symptom of PTSD? I don't know. But what we do know is that there are some kind of, especially when we do testing, there's some distinguishing psychometric properties that do distinguish it from PTSD, and a lot of that is based off of hyperarousal. I wish I had my other slide and I'd give you a much better answer.
I think some of the expressions you put up, excessive violence and cruelty, inappropriate violence, violence among peers, maybe betrayal. I sum that up as failure of leadership, failure of the officer who is in command of that particular body of troops, whether it be a platoon or company or a battalion. The officer has not done his job properly. He's not leading his men correctly. And that leads to all those inappropriate things that you put up there on the screen.
Yeah. A lot of the themes that I got from my patients were very leadership driven.
I think maybe not necessary, because what is appropriate violence in military unit is not necessarily the same as appropriate violence as a civilian. Maybe as a human, when you come back, you have a problem with what you did in the military unit versus what is the standard of rules to live after in the civilian community. Maybe something there.
It is very conflict of environments, conflicts of rules and engagement, all these things. Yeah, most definitely.
I had a question to the same thought. The suicide rate in American soldiers that served in the 2 missions that you mentioned previously has been quite high. And apparently the death rate is higher from suicide after returning than the people dying while in the mission.
It is.
I'm wondering if you could address that in this perspective.
As far as he's asking about the suicide rate in American soldiers and any associations with moral injury, we do know there's been some research more specific to shame and guilt as being a risk factor for suicide. So that's being explored, and we're finding a lot of, through research actually from where I worked, that clinicians should be better about looking at shame and guilt for assessing risk for suicide. And the opposite of that, the inverse relationship to that, optimism, future-oriented, those things serve as protective factors against suicide. So yes, most definitely.
Could that imply that, from my understanding, is that a lot of the soldiers recruited for those missions were recruited from the really poor part of the society. And after returning from the missions, I presume most of them went back again into the same environment that they originally were recruited from. Could what you say imply that a sense of hopelessness and lack of optimism for the future also could be somewhat connected?
So are you referring to American soldiers coming from a poor environment? Is that what you're saying?
From the more like the ghetto environment. My understanding was that recruitment was rather...
The military in the U.S. is very diverse and very broad. So we have military people come from lots of different environments. We have military personnel, yes, that come from impoverished environments and probably have low education, but we also have military personnel who are highly educated and come from prestige environments, and this is kind of in their tradition to serve. So it's a very, I'm not sure I would say that most military personnel come from this type of environment, but we do say like certain branches tend to be affiliated with certain populations. To talk about hopelessness and future-oriented is a very broad topic, and it's based off of kind of who you are as an individual and how you've been raised. And there's a lot of talk right now on how do we better recruit for psychological fitness for the military based off of that. How do we ensure that military personnel are recruited and they have at least a level of resiliency to withstand not only just war, but just being in the military, because the military is a very stressful environment. So there's a lot of talk about how do we better kind of assess that and make sure that we're teasing out the individuals that may not be resilient enough, because it costs a lot of money to train them up, get them up, and then unfortunately phase them out for mental health reasons. So yeah, so I'm not really answering your question because it's hard to the concept of optimism is so broad and it's so individualistic, but we do know that in the military there is a lot of work on assessment and selection.
I didn't voice it so well.
No, it's okay.
Bearing in mind the brokenness of the American society, which for sure would result in a broad recruitment as well.
Yeah.
Has there been any indication from research that you know that indicates that the amount of suicide somehow is connected to the social, from where people came to socially when they were recruited and where they went back again, or is it totally individually dependent?
I mean, we know in general. Oh yes, sorry. So he's asking about whether or not the military suicide rate is connected to their social economic status background. We do know in general research that yes, that your rate does go up, your suicide risk does go up if you're coming from a lower impoverished area, low social economic status. But as far as military personnel go, specifically, I'm not aware of what research says specific to their background, particular to the money that they come from, but I'm sure it's out there because there's so much research right now on military personnel and what to do about it. A lot of the research that I've been involved in is kind of based off of how does trauma impact suicide? How does shame, guilt, optimism, those sorts of things impact suicide risk? But related a little bit to that, we actually have done a study on background if you identify as being we call same-sex behavior oriented, homosexual, does that increase your rate for suicide? And we're finding that there are some elements to that does increase your rate for suicide, probably because the environment is very discriminatory and has some time to grow, and making sure that it's more accepting for the population, and it's a very stressful population to be homosexual. And so we're finding that may be a risk factor for clinicians to just better kind of hone in and explore when they're doing their suicide risk assessments. So, yeah. But this is why I love moral injury. It always gets people talking. It really is an interesting topic. There's been a lot of really good spreads on it that can do a lot better than I can right now. Like I said, shooting from the hip, talking about moral injury. But Huffington Post, if you Google moral injury, Huffington Post, they did like a 16-page spread on moral injury with examples, patient stories, and whatnot on the concept. So that I highly recommend that read. It was published, I'd say, like 2 years ago, but it's a really good, relevant read for this topic. Any other questions? Like to talk about moral injury more than sleep hygiene, at least. Okay.
Ja, skal vi se, jeg må gå foran kamera nå.